an example of a sample scenario item. The scenarios that will be on the exam will likely follow this basic template where you have the setting, you have the sex, it won't say gender, it will say sex, the age, the presenting problem, so where you encounter the patient, medical history will be there, so any kind of medical history, past medical or surgical history. Other information is where you can find information regarding medications that the patient is on, or living environment, or social support, or functional status, medications, and social or health habits. Physical therapy examination will be just that. So it will. This is where you'll find information about their pain level, or maybe vital signs, or their strength test results, or their balance test results, and then the physical therapy plan of care. So this is just an example of one scenario that we see. And you see the item that goes to that scenario. Again, you should not be able to answer this item without using the information in the scenario. This is an example of a physical therapy cardiovascular examination, so tests and measures. And the question is, which of the following measures is the most appropriate target aerobic exercise intensity? So I'm just going to share the reasoning why the key is 4, which is modified Borg rating of perceived exertion of 8 to 10. The candidate has to know that this patient has Parkinson's disease. They have to know that patients who have Parkinson's disease might often have autonomic dysfunction, which can blunt cardiovascular response to exercise. And so they should decide between 3 and 4. And then patients who have Parkinson's disease benefit from high intensity aerobic training to promote neuroplasticity. And this is why 4 is the key. And this is just an example, but just giving you some rationale behind why 4 is the key. So again, this is another example that goes to the same scenario. This question is an example of the impact of pharmacology used to treat the nervous and neuromuscular system. And the question is, if the patient takes all of his prescribed medications at one point in the afternoon, physical therapy should be scheduled during which of the following periods of time? The key is 3, and the rationale is basically the patient has Parkinson's disease for which he takes carbidopa and levodopa, or levodopa. Motor performance is usually best for patients between 20 and 60 minutes following the use of this medication, and therapy may have the most benefit for patients during this window of time. So that's why that's the key. And then this is the last example I wanted to show you as an example for the scenario-based items. This is an example of equipment, devices, technologies. So this would fall under our 4,000 rubric. Which of the following assistive devices would be most appropriate for the patient to use when walking outside? Again, definitely can't answer that question without looking at the scenario. And the key is option 4. Again, patient has Parkinson's disease. You have to look at his timed up and go test time, which would suggest that he is at a high fall risk, that outdoor ambulation presents a greater challenge. And so the patient will likely need greater stability and a device that might limit dual tasking. And so a front-wheeled walker is likely the safest device that would promote mobility. And that's why that's the key. This is our website. You can type in demo exam here and you can start the exam. I hope that you all can see this. So this is an example of the security agreement. And this is the tutorial. We have a lot of questions, which is about, can my students replay the video? And the answer is yes, they can definitely replay. And this is going to show what they're going to see in the tutorial. We would suggest that they click the loop button to activate continuous looping for the video. It's suggested that you click the looping button before you play the video, so that they just click that once and they don't have to worry about it continuing to play as they read the stem and the options. And they can alter the video speed to slow it down or to play. So I'm going to just start the test and show you. Number 12 is the video, and this is what it looks like. It says that this page requires scrolling, so you'll have to scroll, and then you can toggle the loop here, and then you can press play. This is how the video will be shown, and you have the stem up here and the options down here. And as I said, you can slow down the video if you'd like, however really slow you want to go. You can slow it down. You can also pause the video if you'd like. So I just wanted to show that to you in terms of video items that are on exams and will continue to be on exams.
If you need help with the step-by-step process from start till end to have unlimited access to the class and for you to save time and prevent delays, there is a masterclass for that available 24/7 wherever you are in the world. As long as you have internet access, you can access that masterclass. It's called the USPT Turbo Charge. Okay, so that is the masterclass, especially if you have no idea what you're doing, you're stuck and you don't know how to proceed, but you want to really fulfill your American dream. In just one masterclass, it will answer hundreds of your questions. Okay, if you are going to start your US practice, but you have no idea how to document the US style way of documentation, I will walk you through the step-by-step process from PT application. There is a USPT dynamic documentation to progress notes, daily notes, discharge summaries, updated plan of care. That is the USPT Notes Masterclass. So these masterclass are designed for foreign educated physical therapists to improve your confidence and competence. So when you face your first patient, or I don't care how many patients you have faced, but you want to build up your confidence and increase your skill as a therapist, this masterclass is for you, okay? And also there's a masterclass that I made that is exclusively to improving the skills, the clinical skills, you know, the action in the clinic. How are you going to improve to decrease the fall risk of your patient in a very effective way that is research backup? You know, the techniques, the strategies that I do with my patient to win the heart of my patient, to improve their function, and ultimately, you know, to give high quality care to our patients. That is USPT golden approach and strategies. And for those who have questions about their visa, the kind of visa that you need to apply here to the US, to work to the US, okay, all questions about visa, again, there is a masterclass for that, and that is the USPT all about the visas. Okay, so check out the link down below. You will find all these master classes, okay, in one page, and you can check them out. The reviews are there. You can see what the actual people experienced through that master classes.